Good morning, everyone. It's good to have you here with us on Sun Up on 7, and I hope that you have been having enjoyable conversations here with us as we talk with Honorable Kareem Musa, addressing crime, and then we talked about what can you do as you prepare yourself to budget for the year, address MAGA season. So we talked with Ms. Angelia Guy as what are some practical things that you can do, and one of the things that came up was using those saving envelopes, to be practical as to how you can go about paying your bills, but also remember to write your budget down because that's the only way how you can know where your markers are. So write those things down, and that was a good pointer for me too. And now we're joined by Dr. Melissa Diaz via Zoom. She's a Deputy Regional Manager at Central Health Region, and we're talking Omicron, something that's here, COVID is here, and of course we're seeing an increase in number of COVID cases. So let's talk about what the health system is doing to address Omicron. Good morning, Dr. Diaz. Thank you for joining us via Zoom. It's so good to have you here with us on Sun Up on 7. How are you doing this morning?
Hello, good morning. Thank you so much for the invitation and good to see you all. I'm doing very well, thank you.
Thank you for joining us via Zoom. We're aware that physically we wanted to have you here, but you're quite busy in the swabbing unit at Central Health Region. So nevertheless, we're so thankful for you to join us and give us an insight as to what the health system is doing to address Omicron and vaccinations.
Yes. Well, definitely the entire country has been aware that we've seen a sharp, steep rise in cases over the last week. We had a little respite for about a month or less when we started to see numbers declining, and we were very hopeful that, we could have had, a longer time to rejuvenate and to prepare for our fourth wave, but it came crashing in on us. And we had some time to discuss with our management team and with the team at the Ministry of Health and Wellness what our approach will be for this fourth wave. So looking at the numbers, we know that the Belize district and Cayo district and Stan Creek are the three districts that we're seeing the highest amount of cases. And we are grateful to the population for coming out and for actually getting tested and being concerned with regards to this Omicron variant. As you said, it's here clinically, epidemiologically. We can see that in one household, everybody's infected. In businesses, the entire staff can become infected. The transmissibility, it's very obvious that it's really higher than the Delta variant. So we expect the numbers to go up for the next few weeks. But really, in this case, and what happens to this wave not only depends on the Ministry of Health and Wellness, but depends on us and our personal responsibility that we will take to ensure that we start a downward trend from this variant.
Dr. Diaz, go ahead. We're so eager to have this conversation.
I know. I'm excited about this conversation because, it's a talk out of town. People are always talking about what's happening, and we have a new variant. We're just like, hello. And so with all of that, I want to ask for you personally, being on the scene. I know you've been swabbing, you've been doing the most. I mean, your staff, everyone has been on hand. And so we're at about 24% when it comes to the positivity rate. And we have a high alarming amount of numbers right now, circulating, I guess, because of the holidays, of course. But not much hospitalizations to that extent. So how has it been for you seeing that on the scene when it comes to the data?
Yes, you're right in saying that our hospitalization so far has not gone up. But when you look at, even though, the evidence is showing that symptoms may be milder than Delta, and symptoms tend to be more for the upper respiratory tract. So people coming in are complaining of runny nose, sneezing, congestion, sinus issues. Lots of people said, oh, I thought it was an allergy, I was dusting, I was cleaning. So we're getting that, and when we swab, they are coming up as positive. So, it's telling us, yes, the transmissibility is there, but we have to keep in mind that it's only been a week or so that we're seeing these increased numbers. And just the sheer number of persons being infected will impact our health system. Because as it is, we had to open another testing site at Swift Hall because of the crowd coming in at Civic Center, at our clinics, and at the testing site here at Central Health Region. So we need to wait to say, okay, yes, this has not impacted our hospitalizations, because as the days go on, we're getting more calls of people having more severe symptoms. We've had to bring in people to the clinic. So our vulnerable population remain vulnerable to this infection. So we've got to always keep our guard up.
Most
And
definitely.
we don't want the population to think that, okay, this is something very mild and we will all do well. We've got to protect our vulnerable. And the vulnerable persons remain people that are elderly, looking at our over 55 population, people with diabetes, high blood pressure, cancer, any autoimmune disease, obesity. All these persons are considered vulnerable. So we still have to do our part and protect our vulnerable population.
Okay.
Most
So,
definitely.
Dr. Diaz, so what you're saying is that these populations that you just mentioned are the ones that should get tested if they have even these mild symptoms?
Yes, absolutely. I mean, we're
Okay.
still recommending testing as best as possible, specifically if you have no one in your family that you know is infected or you haven't had a close contact and you start with symptoms. We need to know because then we need to know where you work. We need to know where you've been, who else has been exposed. Sometimes when we have 5, 6 family members positive and somebody else starts with mild symptoms who are not in the vulnerable group, we have to make that assumption that that person has COVID, you know? So we would say, okay, everybody stay at home, keep your house well ventilated, wipe down everything with your Clorox and water, hand washing, wearing your mask. These things will help to reduce any spread. And more importantly, don't allow anybody in your home and don't go out to visit anybody at this time when you have symptoms.
Most
Right,
definitely.
definitely.
Dr. Diaz, I want to ask specifically if you can just outline more or less the symptoms that come with Omicron so people can be aware if I'm receiving these. Because I know you've mentioned here, I've heard people mention here, but to list them out properly so people be like X, Y, and Z is what I'm supposed to be looking out and be on alert for. Because like you mentioned, people think, you know, you're having allergies, but what are the ones that you can be able to identify and say, maybe, just maybe, I need to keep my distance because this doesn't look too correct?
Yes. You know, with any variant from COVID and even with the flu, many of the symptoms are similar.
Yeah.
At this point, the important thing is to rule out COVID first. Okay, because COVID is circulating, Omicron is circulating, and Delta continues to circulate, right? So we've got to ensure that even if you wake up in the morning with something different, you're feeling different than the way that you felt before, if you have back pain, joint pain, weakness, fatigue is one of the common symptoms that people are describing, just feeling extremely tired after going to bed and sleeping a full 7 hours, waking up tired. But as well, that congestion in the face, the redness, the sneezing, headache, a sore throat, scratchy throat. These are the common symptoms that we're seeing with Omicron.
Okay. Thank you for that, because I think it's really important that we know what to identify. Because at the same time, I do want people to go get their testing, but we don't also want to overwhelm the system where everybody at the same time is going. Like you mentioned before, we had to get another center in the Swift Hall to be able to do the testing. Because I think, you know, sometimes when you say go get testing, everybody just like, oh, the minute I have a little sniffle, I'm going to try to rush to go do that.
Yes.
And so
Yes.
that also is a little sticky situation where you're having so much people coming in.
Yeah.
Well, an important part of testing, sorry to interrupt, but an important part of testing is the timing of the test as well. So, you know, just yesterday we had a lot of people and we had to go through one by one, just discussing with them, okay, when were you exposed? And they would say, oh, somebody in my workplace this morning tested positive and I was with them, 10 minutes ago. Well, it's too early.
Yeah.
Your body won't seroconvert as yet. And when you test and you have a negative test, it gives a false reassurance that you're not infected. But you're in the incubation, you may be in the incubation period. And the incubation period for the COVID virus is any time from day 1 to day 14. Now, we do see that with Omicron, the incubation period has lessened to 2 to 3 days or so, you know, around that time. With Delta, it was longer. With Delta, we were seeing 8 days after exposure, somebody testing positive. So the timing of the test is key. And we're asking persons that if you are exposed or if you do start with very mild symptoms, just isolate, let your workplace know, and stay, you know, away from your family, wear your mask, and after 3 days of isolation, come in and get tested, and that would be a much more accurate test. Because you may hear stories that, okay, people tested 3 times negative or 2 times negative on PCR, but even if you do a PCR and rapid test hours after exposure, you will come out negative. Okay, it has to be the optimal time, 3 to 5 days after last exposure with the person who tested positive.
I
So
think
that's really important as
that
well.
I just was gonna say that, Dr. Diaz. That's extremely important because next thing you know, like you say, you have that false assurance that you're negative because you just came in contact, and it doesn't work that fast, guys. Like it really doesn't work that fast. So that idea, I think, what's really important that you mentioned is the isolation at first, and then going in like 3 to 5 days after that isolation to just see where you still stand.
Yeah,
Yes.
definitely. Dr. Diaz, I wanna invite you now to explain in the simplest terms possible the new memorandum on sick leave due to COVID-19, because you mentioned something about if you're feeling ill to go to report to your employer about your current condition and isolate, or if you're COVID positive to isolate as well. But what can you explain for our viewers in the simplest terms? What is this new memorandum about as it regards to the sick leave due to COVID?
Yes. Well, when we looked at the transmissibility of this Omicron, and when we look at the, sustaining our economy and trying to get, and especially with our healthcare workers, ensuring that, the integrity and that our health system is able to treat persons when people do need the treatment, we looked at the time frame of when persons were testing negative after being positive, and that time frame had lessened to about 10 days. So and with Omicron, because the incubation period appears to be shorter, persons start with symptoms 2 to 3 days after exposure, and a lot of persons have become much better after 2 or 3 days. They would experience 1 or 2 nights of fever, joint pains, and then after that feel well. And when they were tested at day 10 or day 9, they have already tested negative. So we felt that it's important, instead of having well people sitting at home waiting for this 14-day period, and especially healthcare workers, we need to get our healthcare workers back, especially if they are vaccinated, boosted, and asymptomatic, and they're now testing negative. We can come back into the workplace and provide the service that we need to provide for persons who are ill. So that was the basis behind really reducing this time, getting people back into the workforce. But definitely, it's just the memo was sent out to the regional managers, so the doctors and nurses will make that decision. So it's not a blanket to say that your employer will call you and say 10 days is up, come back.
Okay.
There's certain things you've got to be. You've got to be asymptomatic, or you've got to be at least 72 hours without a fever, or at least 72 hours without needing Tylenol, ibuprofen, cough mixture, these things. So if you fit certain categories, you come back and you'll get a release letter from us to go back into work.
Awesome.
For the healthcare workers at 7 days, we also are recommending that a rapid test is done to ensure that you have tested negative before going into the workplace. And as you all know, our healthcare workers in our clinics are with their full PPEs. There's no eating together, there's no socializing. So, it's really strict that person will not be spreading any viral particles to any persons that they see, and vice versa. So we have very strict infection control and prevention protocols in place at all our health facilities.
Awesome. Thank you for that
Thank you for
explanation.
that. Dr. Diaz, in regards to the idea of spreading, you just mentioned, we know Omicron is on the rise. We are slowly getting in the numbers, but when it comes to going back to school right here, January 10th, if I'm not mistaken, right? I know you're a mother, and so for that, will you be sending your children back to school? And also, what is your advice to parents that, maybe reluctant or are sending their children back to school? Like, what would be the advice for them?
Yes, I mean, it's a very difficult situation that we're facing in Belize, because of course we didn't expect to have this Omicron at this point so quickly. We're still in discussion with the Ministry of Education, and when we look at cases, we need to look at positivity rate per district. So there are certain districts that are seeing very low positivity rate, and I think with these districts, it's absolutely good to get our kids back in school. Our kids need to be back in school. We've lost almost 2 years of that structured learning for our children. The Ministry of Education is still basing the schools opening on mainly 4 things: the positivity rate in the location that the school is, the vaccination rate of the kids and of the teachers, and the readiness of the school. And this is a very structured environment that the children will be going in. It's not that the Ministry of Education is saying, okay, we'll open up full school, everybody, 30 kids in a class from 8 to 5. It's hybrid. Every school will be doing hybrid learning. And when we look at the plans from certain schools, some schools will be 4 hours, some schools will only have 10 kids in a class, the distance is spaced. Some classes have the shield around the desk. So there are many different measures that will be taken. I plan to send my children back to school. My children have been very well educated with regards to public health measures. There are children, of course, and they are desperate to socialize, and they want to see their friends and everything. But my youngest child had gone back to school in November and December, and he had a very good experience. So there were some schools that were open before. But I think that the discussion continues with regards to which districts will open fully and how it will be. But when we think about it, our kids have been at home, and many of us have sent our kids to play at friends' houses, and they have 4 or 5 of them with sleepovers. So you still have a lot of socializing going on.
Yeah.
Now in the school and in the classrooms, it's a very, very strict environment. So the child is even safer in that environment, going to school at a certain time, following the procedures that the school has in place, and going straight home again, getting homework done, and getting back into a routine, that helps us with the educational system of our country and helps our kids to get back to learning. We've lost a lot of time with our children when it comes to education. So I think that it will be a safe process. But the Ministry of Education, along with the Ministry of Health, will continue our discussions in the next few days to finalize. So I don't think that it'll be the same across the board. Some districts are much better off at this time, and they can safely go back.
Okay, thank you for those words of reassurance, Dr. Diaz, because it's important. A lot of parents have been asking and being very wary about this back to school, but definitely share your experience with your child going back to school last year, and really everything that's being put into place right now to ensure that our child are safe going back to school. It's reassuring, so we look forward to what's going to happen on January 10th. Dr. Diaz, as we wrap up this conversation, do you have any last words for our viewers?
Well, I just wanted to go back to schools and just to remind parents and teachers that there are certain situations that you should not send your child to school. If you have somebody sick at home, if you have someone at home in isolation or waiting for a PCR result, if the child wakes up in the morning and not feeling well and has even red eyes, a little sniffling, sneezing, keep that child at home, because we don't want that every single day we've got to close classrooms or make changes to that routine. So there are certain things that the school will overlook to say, okay, if this child can't come in, this child can't come in. It's better to be safe, and it's better to ensure that this is definitely not a child or a teacher with COVID than for them to go in and 2 days after we've got to close the classroom or do swabbing. In addition to that, the Ministry of Health and Wellness, we are working with the Ministry of Education to try to do some routine swabbing before schools open, especially for the teachers, and try to improve our vaccination rate in the schools as well. So we're going to start to go into schools this week, Wednesday, today, tomorrow, Friday, in the Belize district at least, trying to get our vaccine rates up in students and to do some swabbing if we can, just prior to schools opening.
Awesome. So thank you, Dr. Diaz, for those last words. And again, we want to wish you and your staff at the Ministry of Health and Wellness a Happy New Year and all the best in 2022. And thank you so much for all the work that you're doing to address COVID, address the safety and the well-being of our Belizean population.
I really have to say that because, and I just want to quickly just say, one of the, I'm not going to say name or whatever, but I just want to say I love your staff because they've been really responsive. I spoke to a gentleman yesterday about 2 workers that need to get vaccinated but can't move from their work site, and he's already arranging for something to happen so that they can get their vaccination. And so I just want to commend you guys that you really are trying your best to help others that want to get vaccinated. So thank you for that so much. We really appreciate it.
Thank you so much, and we really appreciate the recognition and the kind words as well, because it's just continuous for our staff. And I just want to say that, the Ministry of Health and private sector, we're made up of about 5,000 healthcare workers. So it's a big team and everybody with the same objective. So thank you.
No
Yeah.
problem
And,
at all.
and it was also good having you for the first time on Sun Upon 7. And we hope that you come back again and share some good news about what the Ministry of Health and Wellness is doing. So don't be a stranger. We look forward to having you again here with us, Dr. Diaz.
Thank you so much.
No
Definitely.
problem.
Yeah.
And so
Okay.
with that, we go to our next commercial break. When we're back, we're going to be wrapping up today's show.